So we're here in Lugano for the 15th ICML meeting, which is a very exciting meeting, all dedicated to lymphoma. We're here to present our work on the combination of oral azacitidine and romidepsin in patients with T-cell lymphoma. This study was really born from some of the preclinical findings that we had, really showing some tremendous synergism between these two drugs in cell lines derived from T-cell lymphoma patients. Based on those data, we had conducted previously a phase 1 trial that had clearly shown that the combination of AZA and ROMI is really much more active in T-cell lymphoma than it is in other kinds of lymphoma. And that's what prompted really us to go forward and move forward with a phase 2 trial of the same combination in patients with T-cell lymphoma. We enrolled 24 patients on the study, and the enrollment is completed, and we're now presenting the first analysis at a relatively short follow-up, granted, but with pretty exciting preliminary results. Roughly half of these patients had previously untreated disease, and the other half had a relapse refractory disease. Fairly standard characteristics for this kind of patient populations, roughly in the mid-60s is the median age, and it's a 50-50 split between male and female patients, and most of the patients are Caucasians, and the vast majority of patients had angioimmunoblastic lymphoma, which is a little unusual for a Western country-based study, but this is just what it turned out to be, really. The patients were enrolled consecutively. The treatment was very, very active. Roughly 2/3 of the patients responded, and half of the patients really had a complete response by the 2007 International Project criteria. What's even more interesting is that some particular subgroup of patients had even more exciting responses. For example, patients with angioimmunoblastic lymphoma had a very high response rate. 70% of them responded, and half of them had a complete response. Another subgroup of interest is patients that carried a TET2 mutation in their tumor cells. TET2 is a gene involved in hypermethylation, and the use of drugs such as azacitidine could counteract that pathogenic mechanism. And probably unsurprisingly, about 85% of these patients responded, and 2/3 actually had a complete response. In terms of safety, really our experience confirmed what we had seen in the phase 1 trial. Infections and cytopenias are really the most relevant adverse events to pay attention to. There are others, nausea, vomiting in particular, but those have been well mitigated with drug-specific anti-nausea prophylaxis. We did some correlative studies looking at the mutational landscape of patients and trying to correlate that with their response to treatment. And the presence of TET2 really tracked with responders. The other interesting finding is that the presence of p53 mutations seem to track with non-responders. So I think in conclusion, we really showed that the combination of oral azacitidine and romidepsin is very promising for patients with T-cell lymphoma. And I think it definitely has, going forward, a potential to be part of the armamentarium for these patients that remain a fairly large unmet medical need. In particular, in the relapse refractory setting, I think this combination deserves to be developed further, particularly in angioimmunoblastic lymphoma. We think that a registration-directed strategy is definitely within the realm of possibilities. For patients with newly diagnosed disease, obviously the jury is still out, the follow-up is too short. It is premature to say whether a non-chemotherapy combination can substitute or compete with the traditional chemotherapy combination, but certainly a very early promising signal of efficacy, and further follow-up could tell us if this combination will have a more solid future in T-cell lymphoma management.